Joining us today, whether you're live here with us on this webinar or joining us live on our first ever live YouTube stream, you're all very welcome. This webinar will be in English, and we're pleased also to have simultaneous interpretation into French and Spanish throughout the interpretations panel. So just hit that globe button at the bottom of your screen if you'd like to hear it in French or Spanish in real time. I'm Dr. Sharman, President of IOSH, and I'd like to formally welcome you to today's joint IOSH and World Health Organization webinar. From the beginning of this pandemic, we have been able to support and collaborate with the WHO in several beneficial ways to offer valuable information and guidance, whilst also gathering intelligence that could be used to inform better practice. At IOSH, we're honored to bring you today's information session, organized in collaboration with the WHO. Yesterday, the 17th of September, was World Patient Safety Day. The objective of this annual awareness day is to recognize patient safety as a global health priority. This year, as a result of the COVID-19 pandemic, the WHO campaign is calling on governments, organizations, and professionals to speak up for health worker safety. It underlines the importance of looking after the health, safety, and well-being of all people working in health and social care as a critical prerequisite for assuring patient safety. With WHO and representatives from global and regional health worker institutions joining us here on this webinar today, we're in a great place to look at highlights from yesterday, current actions by professional associations, and collaborations being developed and sustained to protect all health workers' health, safety, and well-being. Today, we welcome our colleagues from the World Health Organization, Dr. Neira, Director of the WHO's Public Health, Environment and Social Determinants of Health Department, Dr. Neelam Dhingra, Unit Head of Patient Safety Flagship, and Dr. Ivanov, Team Leader of Occupational and Workplace Health, who'll be telling us more about World Patient Safety Day, along with the policies, programs, and tools for occupational health for health workers. We also welcome Christiane Wiskow from the International Labour Organization to share the ILO's latest insights on decent work and safe working conditions for all health workers. We'll then invite our panel representing various professional and trade union perspectives globally, including Howard Catton from the International Council of Nurses, Gwen Brachman, Chair of the Scientific Committee on Occupational Health of Health Workers from ICO, the International Commission for Occupational Health, Julia Johnston from the IOSH Health and Social Care Group, and Baba Ai from Public Service International. Thank you to everyone on today's panel for joining us. So to begin, I'd like to invite Dr. Neira to open this session. Dr. Neira, welcome.
Hi, Andrew. Thank you very much, and welcome to all the participants. Thanks for inviting us, and thanks for this wonderful initiative and for all of you responding positively to this invitation. Yesterday was a very important day, the World Patient Safety Day. And you know, all of those special days are critically important to raise awareness, to remind all of us of the importance of patients to be safe. And you know, one day, maybe all of us, we will be a patient. So it's important that the safety is ensured. But we need to make sure that those special days are not just the interest of the media for a few hours, and we need to keep the interest of all of us and the international community alive for a long term. And then we need as well to use this opportunity to remind all of us that if you want to be, as a patient, if you want to be safe, you need a safe health worker to ensure that. And if we want to take this opportunity to reinforce this collaboration and make sure that we raise awareness about the importance of health workers being safe and protected, we need to reinvent something that is called occupational health and safety that already exists, and take this opportunity to reinforce it. The health workers are every day at the front line, and particularly now at this COVID-19 pandemic we are facing, they have demonstrated the importance of having some standards, for those standards to be respected, to be improve every day and to be creating an environment where the health workers can do the best of themselves. So I think Safe Patient Day and Safe Health Workers Day reinforce each other, but make sure that it's not just a day, is forever. I welcome the trade unions and the labor organization workers, and all of us already committed, and I call you as well to use this opportunity, these exceptional times where governments are now dedicating huge stimulus packages to do an economic recovery, making sure that the basis of our health, on our good society and health system, which is investing on health workers' safety and health, is there. So I'm calling for all of you to influence those decisions at the government level, depending on your position and where are you working. I'm sure you can influence that to make sure that the recovery will be healthy and green, but will be as well protective for the health workers and the patients. Thank you very much again, and over.
Thanks, Dr. Neira. We'll move now to one of Dr. Neira's colleagues at the WHO, Dr. Neelam Dhingra. Neelam, welcome.
Thank you very much. Really appreciate this opportunity to connect with our colleagues from occupational health and also joining in the global movement for patient safety. So now it truly becomes a global movement for patient safety and health worker safety. I'd just like to show some slides, and I just want to reiterate what Dr. Neira mentioned, that the World Patient Safety Day actually has really drawn attention of the global partners, and it has really gained a momentum which has never been reached before. It has huge potential to act as a torch-bearing platform to spotlight on issues which are of global, national, and local concern, and it has really lived up to its name and also the opportunity these days provide. So I'd just like to share with you that patient safety is actually avoiding harm to patients when their care is provided, and it underpins the principle of first do no harm. Because first do no harm is something which the health system is responsible for everyone who is part of the health system or who is coming to health system for care. So it is not only for patients that we have to say first do no harm, the health system has to look after the health and the safety of its health workers as well. So, and it is one of the most important components of healthcare delivery and critical to achieving universal health coverage. I just want to share with you some figures from the studies which have done recently in 2018, where the estimates are that in low and middle income countries, every minute 5 patients die because of unsafe care. And these are only in the low and middle income countries. And if you look at the data from high income countries, it's even almost 1 in 10 patients are harmed in healthcare. So it has major implications because it has cost implications. 15% of total hospital expenditure is in OECD countries goes on managing safety failures. The total cost of harm actually amounts to trillions of US dollars every year globally. And it of course has a major impact on trust. While we are trying to get expand the health coverage and get more and more patients and people to be reached out, if they don't have trust in the system, they would not come to the healthcare system. The psychological cost of patient and the family is huge because of harm and even deaths, and it leads to total loss of credibility of the health system. But I think we shouldn't forget from the health workers' point of view, even looking at this perspective of the impact of patient harm, directly they are second victims because nobody comes to work to harm anyone. And the environment they are getting to work, if that environment is not conducive, not safe, then there's high risk of errors and harm happening to patients. And then the health workers themselves, who with all good intentions are treating and alleviating suffering of patients, they actually become second victims. And it's a very, very important aspect of health worker safety. 2019, last year, the World Health Assembly had a watershed moment where after 17 years, patient safety was addressed at global level and a resolution was adopted on global action on patient safety. It has several operative actions asking member states as well as WHO, but most importantly is recognize patient safety as a global health priority and also establish an annual World Patient Safety Day. So last year was the first day when we were together with our global partners, actually created a visual identity and legacy for patient safety and World Patient Safety Day. These logos were created after a lot of efforts, and now these are being seen all over the world. Yesterday, the day was phenomenal, amazing outreach, and stunning pictures have come. I just got a picture from Berlin Tower, TV Tower, where this logo is actually being depicted on the tower. So around the world, now people are recognizing patient safety as a key priority, and also the color orange actually has become the signature mark. And literally we paint the world orange on every 17th September. And this is the Jeddah, which also was lit up last evening. Moving on from 2019, we come in the beginning of 2020, and we are faced with a major unprecedented pandemic. And that actually, from the beginning, it unveiled several challenges which are being faced by health workers, even in the most advanced and developed healthcare settings. And you're all familiar with it. The risk of infection, patients who acquired COVID infection, those who lost their lives, and they were still at the front line, serving the patients and looking after them. Stress and depression associated with health provision in general, but also particularly during the COVID-19 time. Stigma and violence and physical effects. So there are major challenges which health workers face every day, and there are strong linkages to patient safety as well. Because those who are, suffering from insomnia or depression and anxiety, they will also not be able to perform as best they would like to when they work. And there's stress and burnout and depression. All these have significant impact on safety of patients. There are several studies which show, even one study which shows twice as likely to be involved in patient safety incidents if physicians are suffering to overall burnout. So with this backdrop and background, when we were working with partners to look into the theme for this year World Patient Safety Day, it came very clearly that health worker safety has to be brought to the forefront and global attention, and its linkages with patient safety, because it's World Patient Safety Day, and everything the health worker is impacted on impacts patients as well. So it's a priority for patient safety, and the slogan we gave to the global audience was safe health workers, safe patients. Several campaign materials were developed for this campaign, which have again reached out to the entire world. And you can see several social media cards, posters, memory sticks, and banners and t-shirts. We were in these t-shirts in the evening yesterday at Jeddah taking pictures, because that's very important for advocacy. So these campaign materials around the world have helped countries to create the awareness of public on the need for health worker safety and patient safety. Most importantly, WHO DG Dr. Tedros and DG of ILO, Dr. Ryder, together with Mr. Jeremy Hunt, launched a landmark charter, a charter for health worker safety, a priority for patient safety, which identifies 4 overarching areas of work, identifying that health worker safety is now more than ever. Looking into synergies between health worker safety and patient safety policies and strategies, developing and implementing national programs for occupational health and safety, protecting health workers from violence, improving mental health and psychological well-being, and protecting health workers from physical and biological standards. And this goes into several details of key actions. In addition, the WHO also launched World Patient Safety Day goals, and these are goals which we are urging healthcare facilities and leaders who are providing care at the front line to implement in their services, which has direct impact on health worker safety and patient safety. And these goals are prevent sharp injuries, reduce work-related stress and burnout, and also improve the use of personal protective equipment, promote zero tolerance to violence against health workers, and report and analyze serious safety-related incidents, both in health workers and patients. And we are now urging the global community to sign up to both the charter and the goals. And these goals are going to be for 1 year, and then we are going to analyze after 1 year how these goals are being adopted as well as implemented. In addition, we also launched some technical guidance documents. In particular, WHO had been working on patient safety incident reporting and learning systems, which identify the role of health workers as well as the patients, both to be involved in reporting. And these incidents report actually are really the sort of the bread and butter, I should say, of patient safety, because it's obvious that if something has gone wrong in the system, we should learn from the system. And then once we have the learning, then we implement that into policies and practices. So these guidelines actually were authored by Sir Liam Donaldson, who's WHO Patient Safety Envoy, and these were really awaited. So I'm very proud that we were able to launch them also yesterday. And as I mentioned already, this was a signature mark of World Patient Safety Day. And I'm really proud that we were able to create this awareness around the world on patient safety and health worker safety. Just to conclude and share with you that WHO launched a Flagship initiative, a decade of patient safety from 2020 to 2030, beginning of this year. And this actually aligns with the resolution which was adopted last year, which asked for countries to take action for a period of 10 years, aligned with the Sustainable Development Goals. And we had a very significant and important global consultation in February, where we had all key partners, and this was heavily supported. Just to share with you some of the key areas which we are going to work on, in addition to World Patient Safety Day, we are working on Medication Without Harm Challenge, which we are giving to countries to bring about change management programs in their day-to-day work in health facilities and also for policymakers. Several strategic approaches have been recommended for Medication Without Harm Challenge, which is a challenge for 5 years. Patients for Patient Safety, particularly emphasizing the need for patient engagement and empowerment, incident reporting and surveillance systems, global patient safety network to develop strategic partnerships and also look at working in teams to support countries and where the need is required, and a global patient safety collaborative, which is supported by the UK government. It's a joint pioneering model initiative of WHO and the UK government to provide support to low and middle income countries on education, training, leadership, and patient engagement as part of patient safety initiatives. And also, most importantly, also create an overarching guidance and a policy formulation guidance and strategic objectives for patient safety for the next 10 years. So we actually have now worked on a global patient safety action plan, and you can see the pictures here. It is now open for consultation, public consultation now, which is till the end of this month, and then it will go to the World Health Assembly next year. So towards zero harm in patient care is something which we are calling for around the world, and as a vision where no one is harmed in healthcare, and every time, everywhere, everyone gets a safer care. And this action plan defines 7 strategic objectives as part of its framework for action. And with that, I would like to conclude this brief intervention. And I really appreciate this opportunity. And I think we're all joined in speaking up for health worker safety and patient safety, particularly focused action now after the launch has been yesterday to take forward action on health worker safety and patient safety together. Thank you so much for that.
Neelam, thank you for an excellent and thoughtful summary. Let's continue staying at the WHO and this time turn to move to Dr. Ivanov. Ivan.
Good morning, good afternoon, good evening, everybody. I'm Ivan Ivanov, and I'm the team leader for Occupational and Workplace Health at the World Health Organization in the Department of Environment, Climate Change and Health that is led by Dr. Maria Neira. And today I would like to zoom a little bit on the outcomes of the World Patient Safety Day that are relevant, particularly to the protection of occupational health and safety of health workers. Can I have my slides, please? Okay, so after this wonderful day yesterday, we need to make sure that we take good care and we continue to take good care and even better care for those who care. Next one, please. There is already a lot of statements and commitments. Last year at the General Assembly, there is a resolution on universal health coverage where the heads of state and governments committed to action to promote healthy and safer workplaces and improve access to occupational health services for all workers. And it should include also the health workers, and specifically to take actions at the country level to protect health workers from violence, attacks, to improve their working conditions, work environment all the time, and to promote their physical and mental health. Next one, please. This year, the charter that was yesterday launched on health worker safety, a priority for patient safety, has one specific objective to develop and implement national programs for occupational health and safety of health workers, calling upon countries to develop such programs in line with the national occupational health policies, develop written policies for health and safety in all healthcare facilities, also at the national level, appoint people or some bodies, warm bodies, who to have responsibility and authority for occupational safety and health at the national and at the facility level, and to ensure that they collaborate with the other programs such as patient safety, infection prevention and control, and quality of care. develop standards, guidelines, codes of practice for occupational health and safety, and to strengthen international intersectoral collaboration of health worker patient safety with worker and management representatives, giving due consideration to gender diversity and occupational grouping. And I'm very pleased to see that the panel today has achieved such diversity and is representative of everybody and all stakeholders. Next one, please. Several years ago, WHO and ILO issued a global framework for the development of national occupational health programs for health workers, which has 13 elements to develop policies, to appoint people, to establish occupational health services, to provide budget, to make sure that there's personal protective equipment, to ensure also forms of dialogue between workers and employers and managers in the facilities through health and safety committees or at the national level, to provide education and training for all responsible persons for in health and safety committees, to carry out regularly risk assessment of workplaces and processes, to provide immunization against hepatitis B and other vaccine preventable diseases, and hopefully soon we'll have the COVID vaccine, and the health workers will be among the priority populations to be vaccinated, to ensure a free blame culture for exposure and blame-free culture for exposure and incident reporting, to also provide diagnosis, treatment, care, support for occupational infections and other occupational diseases, information, compensation for work-related disability, research, evaluation, environmental hygiene, having water sanitation in all healthcare facilities, important together with managing healthcare waste management, cleaning and disinfection. Next one, please. Yesterday, together with for the World Patient Safety Day, we launched a couple of technical documents that provide more information about the different initiatives and more arguments for action. One of these is a joint collaboration and joint document by the World Health Organization and the International Labour Organization to elaborate further on this joint global framework for the national programs on occupational health and safety for health workers, and this is caring for those who care, which provides arguments for protecting health workers, some evidence also, which provides also the global call for action and the arguments for policymakers, for workers, for employers, managers of healthcare facilities, why they need to have such programs, explains about what are the national programs for occupational health for health workers, provides the key elements of an occupational health program for health workers, as I already presented according to the global framework. What is the added value? How countries can develop and implement such programs? We have more than 50 countries that already have developed such programs, and we have reviewed the experience of these countries and also the factors of success, such as, for example, capacity building. Next one, please. In addition to this document, we also issued one checklist for healthcare facilities on protecting health and safety of health workers. And this checklist is based first on one global survey about 5,000 respondents worldwide in more than 120 countries about the risks and more about the preventive measures for the different risks and the different groups of risks, whether they exist or not. And based on this survey, we translated the questions that seem to be quite well understood globally. We translated this into a checklist and arranged these questions into management of occupational health and safety, prevention of physical risks for health and safety, prevention of occupational infections, prevention of psychosocial risks, and also if there are any additional measures. The checklist is intended for managers of healthcare facilities, health and safety committees, for health inspectors, for anybody who wants to know what is rapidly to know what is the status of a healthcare facility in terms of protecting health and safety of health workers. Next one, please. And we also launched a free online course, Occupational Health and Safety for Health Workers in the context of COVID-19, which is through our open WHO platform for free online courses in the context of public health emergencies, which includes also modules on infectious risks for health and safety, physical risks, psychosocial risks to health and safety, and basic occupational health and safety services and facilities in healthcare services. And it is free. It is currently being translated also to French and Spanish, and there will be also many translations into national languages. So we encourage the dissemination. There are already more than 30,000 enrollments in this course, so it has big interest. It is only 1 hour, and it is intended for regular health workers, not for managers, not for specialists, but it's intended for regular health workers to increase their awareness and to give them some advice and some tips on how they can continue to serve and be safe and healthy. Next one, please. And I just want to give enormous gratitude to the Director General of WHO and the Director General of ILO, who have yesterday, they were together at the joint press conference, and they committed, both of them, to scale up and to support the action on protecting health workers, improving occupational health and safety of health workers, and make sure that all health workers also enjoy the right to health and safety and to work, and the right to decent work, just and favorable working conditions. Thank you very much.
Thank you, Dr. Ivanov and Dr. Dhingra. You know, I watched a great movie just a couple of nights ago. It was called The Fundamentals of Caring, and it was about how care workers are trained to look after people. Of course, it was a Hollywood blockbuster, but something in the opening lines caught my attention. It said that rule 1 of caring is that the carer must take care of themselves. Otherwise, they can't take care of anyone else. And we're all carers, whether as IOSH professionals or as health workers. And we all therefore need to take care of ourselves and of each other. So I'd now like to invite our panel and have a discussion to seek their professional views on the subject that we're talking about today, and learn more about the individual calls for actions for professionals, including the trades unions perspective too. So firstly, I'd like to pose a question to our panel. And the question is this: what challenges are your members or professionals facing at the moment? Howard Catton, International Council of Nurses, thank you for joining us today. Can you give us an idea on the challenges faced by nurses? What have your findings been? I understand that a report's been recently released by ICN on protecting nurses from COVID-19 as a top priority. Howard, can you tell us a bit more about that?
Very happy to. Andrew, thank you very much for the opportunity. Thank you to IOSH as well for this great webinar following on from last week's as well. Delighted to participate. Just a few days ago, we released a survey setting out findings from our national nursing associations, the situation in relation to nursing and COVID. I'll post it in the chat, the link to our website. We've been monitoring this since the beginning of the pandemic. What we found, top lines for you, we are now aware of more than 1,000 nurses who have died as a result of contracting coronavirus. That's in 44 countries, and I sadly have to say the true number undoubtedly will be higher than that. There's a huge range in terms of the infections amongst all healthcare workers of COVID. Can be very, very low down at 1% up to 30% plus. We think on average around the 10% mark, possibly a little bit more. Think about 30 million COVID cases, that's 3 million health workers who may be infected. So, you know, the clapping stopped, but there's in no doubt health workforce are absolutely remaining at the eye of the pandemic, and it's putting a huge strain and toll on them. And some of the other findings, and I think it's important to highlight these because it's not just as significant as the deaths and the infections are, there is still a problem with PPE. Care homes Non-hospital settings, primary care, long-term care facilities, our associations reporting there are shortages. There are problems with getting testing. Testing where it does exist is really just for symptomatic healthcare workers. We're still not collecting standardized data on deaths and on infections. Some countries are collecting it where they are. You're often looking at apples and pears in terms of definitions. As we all know, the data will drive analysis, science, and improve infection prevention and control. And also, really significantly, we found less than half countries, and again, I think that might be at the high end, but less than half countries who are recognizing COVID as an occupational disease. Now, you know, some people say, oh, is that some techie issue? I know I needn't tell you this, but again, recognition of COVID as an occupational disease means that we're going to get reporting, we're going to get better risk assessment, we're going to get standards set. We're also really importantly going to get compensation, and it's not just for people who die, but you know, we know that COVID can last a long time for people. Ill health and disability, we need compensation for all that. And then the final really big issue, which feels like a bit of a hidden issue to me in terms of the scale of it. It's sorry to say, it has the feel of it being slightly icebergish at the moment. The enormity of the mental health pressures that our healthcare workers are under. Still reports of violence and discrimination, but the psychological pressures starting to show in terms of some sickness, absenteeism. I really worry about what the long-term impact of all of that is going to be. So we're absolutely delighted to support World Patient Safety Day with the focus on health workers yesterday. The charter, great, we're absolutely behind it. We've been out calling strongly, back the charter, but it needs more than just a backing. It needs action to implement the details that are in that charter. Back to you, Andrew.
Howard, thanks for that excellent summary. I think you really brought some light to what's going on for ICN and for nurses out there. Thanks for doing that so clearly. Dr. Gwen Brackman represents the ICO committee focusing on occupational health of health workers at an international level. Gwen, what would you say are the collective concerns faced within the sector right now?
Thank you very much, Andrew. So I think you can all see my slides, correct?
Yes, we can.
Okay, great. So first of all, ICO is an international non-governmental professional society, and we're the oldest society that deals with occupational health. And we deal with this for all work sectors. We have over 2,000 professionals from 93 countries. We have 37 scientific committees, one of which is my committee, the Scientific Committee on Occupational Health for Health Workers. We have several working groups. And the purpose is to foster scientific progress, acknowledgement, and development of occupational safety in all its aspects. And we are absolutely delighted that this year, World Patient Safety Day has focused on health worker safety. Okay, the risks for health workers, and health workers, by the way, are doctors, nurses, other people who give care, but also include our supportive staff of sanitation, transport, administrators. We all have these risks. And the risks are biological, but it's more than just biological, more than just infections. And these risks have always existed. There are also chemical risks, psychosocial risks, physical risks, and ergonomic risks. What has happened during COVID is these risks have just become exacerbated and have come to everybody's attention, particularly the attention of the public. Based on the survey, because we helped WHO with the survey that Dr. Ivan had alluded to before, is one of the biggest problems is the shortage of health workers. There are 60 million health workers in the world, 80% are women, but there's also a shortfall. At the moment, there's at least 7 million shortfall of health workers. This is expected to increase to 13 million by 2035, and probably will exceed this because of the attrition that we're going to get from COVID. The workloads and the shifts have increased dramatically. There's an inadequate amount, and the quality of the PPE is not always very good. There's a lack of education and training for health workers. And we've seen this, again, from the survey from many countries. Many countries don't even have programs in their facilities for occupational health and safety. The psychosocial stress, burnout, anxiety, and depression has been alluded to before. Violence and stigma has been a big problem. And because of the PPE, we're seeing more problems with latex allergies, skin dermatitis, facial dermatitis, and low back pain because of the ergonomic problems in makeshift workplaces. Thank you.
Excellent. Thank you, Gwen. That's a terrific international perspective that you bring for us here. Really appreciate that. Thank you very much. Julia Johnston of the IOSH Health and Social Care Group, and from our own professional remit as an OSH professional. Can you share some examples of the challenges faced across health facilities and the social care sector, or perhaps the risks that have increased with the pandemic, Julia? What does the situation look like from an occupational safety and health role, please?
Yes, certainly. Thank you to WHO and IOSH for this opportunity. Now, I'm happy to share recent challenges experienced as a health and social care OSH professional, while supporting the processes in our organisation to ensure there's adequate PPE for our staff. There's been a real focus globally on the availability of PPE and RPE, and Howard and Gwen have also touched on that too. Not a challenge, but an essential is working in collaboration with our colleagues from infection prevention control, procurement, clinical and medical staff to provide the appropriate advice and PPE that meet the standard required, and of course essential is the risk assessment. Now this collaboration was done, in daily huddles, strategic meetings, regular communications with colleagues at all levels in health and social care, both internally and external to our organisation. As Neelam mentioned, the importance of reporting incidents is key, specifically where PPE has not been adequate, or, for example, if staff have had adverse events, as Gwen had touched on, when wearing PPE such as the masks or the gloves, which they may well have a sensitivity, providing advice and linking with OH colleagues is certainly, from an OSH professional point of view, is what we do. We are that point, that signpost and that point of contact and point of advice. Now, specifically in reference to the use of FFP3 masks and face fit testing programmes, certainly in the UK we have face fit testing programmes, and there's been an enormous amount of work and input to support staff to ensure that they've been tested to tight-fitting face masks. The face fit testing programmes have been a challenge with establishing face fit testing. To carry out the test for qualitative or quantitative testing. For this is key that the information instruction training has also been carried out to ensure that staff understand how to don and doff their masks correctly, to ensure they have tight-fitting face pieces that work with other pieces of PPE, such as gowns or hoods or visors. We found logistical challenges, also support sourcing supplies from both qualitative and quantitative face fit testing kits, not just in the PPE side of it, because this was happening globally, of course. We need to ensure, we've always had to ensure there's adequate record management in place for pass and fail rates, and there are governance arrangements in place for the regulator, developing safe operating procedures, RP policies and procedures. They're essential from the governance perspective, even while we've been working dynamically in health and social care, because you would have seen the amount of work has been going on. Now that services are going back to normal activities, staff who were trained as face-fit testers who were clinical or non-clinical, they're returning to their substantive posts. Therefore, there is a gap in that, that we no longer have as much of a pool on the face-fit testers, and we have new products coming online. So another challenge. We did, during the pandemic, liaise with external face-fit testers, and at one point in Scotland, support was provided by the Army, although not in my board, but there was support from the Army. And of course, there's some staff that are unable to be fitted to FFP3 masks, and what would normally be an alternative would be the powered air purifying respirators. We've not been able to use these powered air purifying respirators for COVID or reusable FFP3 masks, as this was not approved and there was no clear advice with regards to changing filters, decontamination of the RPE and the assurance of sustainable supplies. Therefore, local risk assessments are required to be put in place. The lack of sustainability, supply of masks and ever-changing products in turn causes anxieties for staff. Therefore, clear communication to staff and getting that information out to our staff at all levels has been a challenge. But on a positive note, I believe from our experiences in collaboration and working together, this has positively raised the profile of the IOSH professional in health and social care.
Thank you, Julia. I agree with you. I think we have a remarkable, never before seen opportunity for IOSH professionals right now to stand up and lead forward through the pandemic as we bring businesses back to work safely and healthily. I'd now like to invite Baba Ai from the International Health Workers Trade Union, Public Services International. Baba, good to see you again. What are the unions seeing as persistent challenges faced by those on the front line?
Thank you very much, Andrew, and IOSH for this opportunity. 14 million of the 30 million workers, public sector workers, whom PSI represent across 154 countries, are health and social care workers. So this has been of great concern for us. And right at the beginning of the pandemic, the PSI General Secretary, Rosa Pavanelli, wrote to the Director General of the WHO, pointing out that the shortages of PPEs was an emergency within the global health emergency itself. It still remains so to a great extent. And some of the recent statistics from the WHO confirms our fears. Just yesterday, it was pointed out that 1 out of every 7 infected reported infected person is a health worker. And health and social workers constitutes barely 3% of the global population, and in the global south, less than 2% in several places. And it goes to say that, I mean, that average doesn't even tell the full story. In some places, it's as high as 35%. You know, so for us, these underscore some arguments we've been made, and which our affiliates in different countries are pursuing with governments and with employers, which is for the utilization of the precautionary principle in assessing the situation, in considering the mode of transmission, and in reaching conclusions on personal protective equipment to be provided and IPC measures to be taken. We've been winning in a number of countries, but the global norm is also quite important, because earlier in the pandemic we saw the CDC in the United States, for example, lower its bar in this regard, and which led to a rave of protest by members of our affiliates. You've also had across several countries where our efforts to demand workplace safety has been met by repression. You've had our invoking the ILO Convention 155 in several, including Hong Kong, including Malawi, including Zimbabwe. In Zimbabwe, the nurses were all arrested, 13 of them, for demanding that measures be put in place to safeguard their health. Currently in Liberia, the health workers are in the second day of a national strike, very unfortunately, because you've had health workers being made to wash and reuse latex gloves. So these are issues of critical importance, and for us, it is important that governments.
I think we may have lost the connection there from Baba I at PSI. Thanks, Baba,
it's important that they walk their talk.
I think we're losing your connection a little bit there, Baba. Thank you for that quick summary. I want to move forward, but come back to you because I've got a couple more questions that I want to pick your brains on. So let me invite my final panelist. It's Christiane Wiskow from the International Labour Organization for the ILO's call to action, providing comments on decent work and safe working conditions for all health workers. Christiane. And you're on mute, Christiane. If you can just hit unmute, please.
Yeah, it takes more than just a pandemic to learn how to handle the micro. So, excuse me. So thank you very much for this invitation and this organization of the varied panelists. It's always very engaging to have these discussions. I try now to share my screen for a little presentation to say what the ILO is doing. Can you see my screens?
Yes.
My slides, sorry. Okay, so this is about decent work for all health workers in the context of the World Patient Safety Day. And we are calling for joint action with all of you for health worker safety. So why doesn't that move now? Here we go. For those of you who do not know the ILO, I think it's important to say that we are a tripartite organization. We bring to the table not only the governments, the ministries of labor and employment, but also the representatives of employers and of workers, and one of my dear friends, Baba Aye, you just listened to. The protection of workers is our mandate since the right beginning of the ILO, and it's actually included in the Constitution. And as we are already an organization of more than 100 years, so this is something we are doing. This is our daily work, protecting, assisting all our constituents in improving the protection of workers. Our mandate is decent work. So many people ask, what is decent work? We promote and realize rights at work because we are a standard setting organization. And I think this is a very important impact. People in the health sector, my experience is that they do not consider that labor rights are important for their work, but they are, because all our working conditions are based on labor rights in every country. So it would be good if you look into the ILO conventions and take notion of what labor rights are out there that apply to health workers. Of course, the ILO encourages decent employment opportunities. We enhance social protection because the safety of health workers is not just occupational safety and health. It is much broader. It includes protection regulations from the occupational injuries and diseases, for example. And we strengthen social dialogue. Why? Because only, and our experience is only, if all the people involved get into around the table and discuss what needs to be solved, then you find the good solutions and the sustainable solutions because everybody is on board. So that's the reality in the health sector of the working conditions, you all know. But I think these pictures are very powerful to show long working hours leading to exhaustion, ergonomic risks, the lack of personal protective equipment Baba spoke to, this is not only during COVID-19 an issue, but in everyday work. And in the health sector, we have a high risk of exposure to violence and harassment. Health worker protection is key in emergency response like the COVID-19 now, and COVID-19 pandemic has reminded us of that. And I think that here we have a big opportunity. We have to really use this momentum that we have to bring forward and don't let loose on this quest for safety for health workers. So we need regulations that protect health workers in their health and safety, that provide adequate financial compensation and cover the cost of medical treatment in case of sickness. And our view is that labor rights are key to ensuring the protection of health workers because they are legal instruments. It was evoked by Rory in the chat aside, like there are a number of occupational safety and health conventions. ILO has over 40 instruments just on occupational safety and health. And as I said, social dialogue, engaging employers and workers' organizations together with the ministries and various ministries, because occupational safety and health is not just an issue for the health ministry, but also for other ministries. And getting around the table is important for them to enable them to a voice and their active role. And then we have to look beyond the crisis. And we have really, really strong underlying structural problems in the health sector. We speak about overburdened public health systems, underfunded public health systems. We need safe staffing levels to provide good care. So we need urgently to invest in health employment to address health workforce shortages and decent working conditions. And that was the topic of the Health Worker Safety Day, the Patient Safety Day, is that if you provide decent working conditions, then you get good quality care. We have a lot of standards and tools out there. So somebody yesterday mentioned we have so many policies, but we need to implement them. But before you implement policy tools, conventions, and whatever, you need to know them. So be aware of what your rights are and where you can draw inspiration from. Last year, the ILO adopted the Violence and Harassment Convention. That was really a landmark convention, the first ever international covenant on violence and harassment in the world of work. But I would also like to mention the Nursing Personnel Convention that asks for the adaptation or the adjustment of national occupational safety and health regulations to the nature of health sector work. And tools we have, of course, since we work in the health sector, a lot of joint tools with the WHO. The most recent one we did is in the context of COVID-19, we developed a checklist of measures to be taken in health facilities. All our tools are online available. We will send you the link later. And practically on the ground, we are working with WHO and OECD on the Working for Health program, assisting countries and constituents to really make the argument for investing in health employment and expanding and transforming the health workforce. And that one includes strengthening countries' capacities to protect occupational safety and health of health workers and other emergency responders. And I leave you with this quote of my DG. Thank you very much.
Christiane Wiskow, thank you very much from the ILO for that quick summary there. I'd now like to move on and understand how individuals and organizations can continue to support World Patient Safety Day in their day-to-day tasks. And I want to go back to our panel, beginning again with Howard Catton of the International Counsellors and Nurses. So Howard, how's the ICN continuing to support this campaign? What are you doing?
So Andrew, we're working very, very closely with our associations to bring forward evidence, but then we're going to use that evidence to lobby, to campaign, to take the discussions to governments. Look, here's a charter and here are practical things that you can do. Why aren't you collecting the data? Why aren't you recognizing it as an occupational disease? Why isn't there widespread testing? Are you committed to prioritizing for vaccines? Why aren't you scaling up support? Why aren't you coming out where there are incidents, mental health support? Why aren't you coming out where there are incidents of attacks against health workers and taking a zero tolerance approach and clearly calling that out? So we're doing that, and I think that we need to, we all need to move the charter beyond a global charter, which is great, and we can all on a webinar like this sign up to, but to have some monitoring around what actions governments do or don't take, and have some sunlight on those who do and those who don't take action. But there are a couple of other things which I think that we which prompt a much bigger conversation that we're wanting to also to move into as well. And the great Baba and Christiane have touched on these issues as well. Bottom line here is that we are too few healthcare workers short around the world. For nursing, it's 6 million, and others will tell you what it is for their professions. What we're already seeing some developed countries doing is not moving to recruit to educate more of their own workforce, but to go and recruit from other parts of the world. The other thing that we're seeing, Baba touched on this, and I think that this is an emerging theme or trend, or certainly we're seeing it as well. Unrest amongst our workforce, strikes, disputes, demonstrations, issues around pay and decent work, which is taking people out onto the street in the way that they haven't before. You know, the way that we have valued our health workers by applauding has absolutely said, prompted in them, well, why aren't we economically valued? Why are we dying? Why haven't we got the equipment? Both this issue about educating more, about decent work, about pay, bring us to the fundamental question about how much we are investing in our health systems, what we are prepared to pay, how deep into our pockets we are prepared to go. This is an issue I think that I'm sure others keeps them awake at night at the very time where we need consistency to not only maintain but increase investment in our health services. We're likely to hit a global, we are going to hit a global downturn. How do we maintain and increase the money as economies and the world economy fail? And I think there's a bigger conversation for societies. Yes, it's political, but it's beyond political. It's for people everywhere about how much do we want to spend on our health services. There needs to be a new societal settlement, I think, in terms of those numbers and what we're prepared to pay. I do think we need to, you know, and we need to talk about percentages of GDP that people are putting in. And I think that we also need to take this safety question, give it another edge as well. We've all talked on this about how we know that if we don't do these things, care is unsafe. Is it therefore negligent to continue with health systems that we know are unsafe for patients? Should we be providing healthcare where we know staff haven't got the protection, there aren't enough of them as well? But if we do that, are we then restricting, preventing access to healthcare to people who really need it? Massive, massive questions, but I think that we need to get into that territory. I think that we should lead that conversation as well as all of the important technical safety issues that we've talked about. And I think that we need to, as I said, we need teeth in this. We need ways to hold people accountable to see whether, you know, words are matching actions. Back to you, Andrew.
Howard, I love it. I think such a passionate response to the question here, and really directing where we need to see this change. Let's get Dr. Gwen Brackman from ICO, the International Commission for Occupational Health, in here. Gwen, what can you share in terms of action needed and support so far towards improvements in health worker safety? Given what Howard's just said, from your Occupational Health Committee point of view, what do you want to tell us?
Thank you once again, Andrew. So first of all, health worker safety is essential. We need to have an adequate workforce of health personnel, and without having that, you don't have a healthcare system. The same measures that protect healthcare workers from injury and illness not only promote the health and safety of the health worker themselves and make them better able to do their jobs, but these same measures also protect the patient's health and safety. In terms of what ICO is doing, our individual SC members, as we have people from all over the country, all over the world, many of them are leaders in their countries in terms of occupational health for health workers. We have really increased our work with WHO and ILO. And so most of what we've been creating is really the WHO and ILO products, but helping them by consulting with them. And I want to remind everybody that health workers are not heroes. We're people, and we're just doing our jobs. And it's great to be appreciated, but here's what we need. We need respect for our health and safety. We need safe workplaces with sufficient PPE and other protections. We need continuous education and training. We need a livable compensation and other social and medical benefits. We need to be able to maintain a work-life balance. We need legal protections. And for this, Dr. Ivan had mentioned before, national programs. And so I think the next big push that we're going to be helping WHO do is to establish some guidelines or send out some guidelines for other countries, because like many people have said, we really need, there are lots of policies. What we really need to do is get the ministries of health, the governments and the communities, the unions, everybody together to develop national programs that will, protect our health workers and then in turn protect our communities. In terms of what ICO will do, recognizing there's a global shortage of health workers, acknowledging that the health workforce is a vital resource that we need to protect by establishing occupational health for health workers, and in support of World Patient Safety Day, we will continue to do what is in our mandate, which is to foster scientific progress, provide forums for discussion, participate in international dialogues, provide guidance, create guidelines, tools, and training opportunities, incorporate teaching of occupational safety and health in training programs. This is sorely missing. I don't think any of us who are in healthcare got any information in our training programs of how to protect ourselves, and to foster cooperative relationships with the WHO, ILO, other international communities, and NGO organizations. Thank you, Andrew.
Thanks, Gwen. Let's get Julia Johnston of the IOSH Health and Social Care Group in. Julia, what sort of action or programs would you say are necessary to continue to improve health workers' safety, health, and well-being?
Thank you. Absolutely, lessons learned and lessons implemented as a result of our experiences during the pandemic, internationally, nationally, and locally, should be put in place. We should also have continued support on our staff, for their physical as well as their mental well-being, ensuring resilience for the health workers' safety. Action plans to prepare all health and social care staff from the acute to community to support their resilience in health and social care, not just in pandemic times, but in their everyday roles. For example, consideration for our community health and social care workers whose roles included during the pandemic end-of-life conversations, which would normally have been carried out by our medical colleagues, and perhaps they were more prepared for these sorts of conversations than our community staff. However, we're working so dynamically, they were put in these positions. Implementation of technological solutions to enhance communication to our staff, such as social media and apps for use, would allow staff to be kept informed of new developments and initiatives. Certainly, during the pandemic, the information was very fluid, and staff may not have been getting the information that really needed to have that information, and consideration and reflection back to the media as a whole, that health and social care and health workers are not just doctors and nurses, that it is a large team and that we're all working hard to ensure both staff safety and patient safety. And of course, ensuring that there's adequate resources put in place globally for competent health and safety advice from IOSH professionals to support the implementation going forward.
Thank you, Julia. Just a thought here. I'm noticing in the chat box, and you can all, as participants, open up the chat box. Just click on that speech bubble marked chat at the bottom of your screen. Click on the chat box and you'll see lots of resources being posted by some of our panelists and also some of the attendees with links to get documents, including the latest ICN report, and lots of resources from the World Health Organization where you can run your own campaign using WHO resources. So please do check out through that chat box. And by the way, I'm hoping that in the remaining 24 minutes, I'll be able to pose some of your questions directly to our panelists too. So if you have a question for a specific panelist or speaker today, drop me a note in the Q&A box. I won't be taking any questions from the chat box. There are too many notes in there already. So if you have a question, please click on Q&A and put your question in there and let me know who you'd like me to ask that question to. So let's keep things moving and let's get back to Public Services International. Baba, how are the Global Union Federation of Workers in Public Services aligning the campaign with the day-to-day work of those that PSI represent?
We launched a Safe Workers, Save Lives campaign in March, and which quite a number of our affiliates at the national level have also domesticated and working with. This entails, amongst other things, advocacy, including legislative advocacy for passing necessary policies, and where need be domesticating international labor standards, and also the PSI initiated calls for consideration of COVID-19 as an occupational disease. And the Global Council of Unions, which brings together all the global trade union federations, has passed this as a resolution, and we're collectively campaigning for this. For us also, along with advocacy, there's the need for concerted bipartite and tripartite development and implementation of occupational safety and health policies. In a number of countries, particularly in the regions of the global south, you don't have, where you even have workers on workplace occupational safety and health committees, these are often unpicked by management rather than being genuinely representative of the workers. There's the need to address this, and also the need to consider health workers holistically. Community health workers, for example, have to a great extent been sidelined in several countries, even with regards to provision of surgical masks. Meanwhile, they play a key role in contact tracing. And for us as PSI, we strongly believe that the employee relations, of which workplace safety is a part of, cannot wholly be devolved from the broader political and economic realities. Because when you look at it, things like outsourcing of labor, contracting out, privatization of public health have contributed significantly to increasing precarious work, to increasing shortages of staff, you know, and the great pressures that this puts on health workers. So we believe that this crisis presents the world with an opportunity for a new global social compact that quite clearly puts people over profit and health over wealth. Thank you.
Excellent. Thanks, Baba. Really, really appreciate that. Let's finally then go back to Christiane Wiskow from the ILO. Christiane, I'm noticing a comment from Karen Mitchell in the chat box that seems to have generated lots of agreement amongst other participants. Karen Mitchell saying, I agree with Christiane that we have a plethora of policy documents and guidelines on how to manage the IOSH of health workers. Karen believes what's missing is the political will from countries and governments in valuing the role of health workers. What do you think about that, Christiane Wiskow?
Thank you for the question, Karen and Andrew. And I think sadly enough, it's true. And we have heard it throughout the discussions yesterday, also in the afternoon, that various former government officials also acknowledged that this has not been taken up seriously enough, the occupational safety and health of workers, and that we have to really speed up on this. And as I said, as sad as this pandemic is, it's an opportunity to really make the point that well-functioning and resilient health systems are the key to the health of populations. And that's why I'm so grateful for the theme of this year's World Patient Safety Day, to bring really to the fore that health workers need to be protected. But it's not alone about safety. It is about the whole agenda of decent work, as I said. So we need many players around the table, like social protection authorities, the finance ministries. Everybody has to talk to each other, and that is a challenge, but it's an opportunity as well. Thank you.
Excellent. Thanks, Christiane. There's a couple of interesting points coming in on the chat, particularly from Jacinta Onwekwe, who's saying there's actually been a huge challenge for the health and safety of healthcare workers. The pandemic's a wake-up call, and I think Jacinta's exactly right there. Anna Maruta's saying the pandemic highlighted how unsafe health facility environments are. Many health workers have died of healthcare-acquired infections like TB. I think there's some really useful discussion and some really useful spotlighting here on the health and safety of healthcare workers. So thanks to our panel for some very useful insights backing World Patient Safety Day. If we still have time, I want to invite you all back to answer some questions that are coming through the live Q&A box. But before we do this, I want to have a quick short video to share from North Macedonia, showing how they monitor the health status of health workers. Let's take a look at that now.
Светската здравствена организација на 17 септември го одбележува Светскиот ден на безбедноста на пациентите. Оваа година со тема Безбедност на здравствениот работник, приоритет за безбедност на пациентот.
Актуелната COVID-19 пандемија изврши силен притисок врз здравствените системи кои може да функционираат само со квалификувани и мотивирани здравствени работници, обезбедувајќи квалитетни здравствени услуги кои го ставаат пациентот во фокусот на здравствената заштита.
Здравствените работници во услови на пандемија се изложени на зголемен ризик поврзан со инфекции, болести, повреди, стрес, насилство и смрт.
Работата во вакви услови го зголемува ризикот за грешки кои може да ја загрозат безбедноста на пациентите.
Нашата држава и Министерството за здравство ефикасно одговорија на овој предизвик со реорганизација и јакнење на капацитетите во здравствениот сектор, при што здравствените работници со својата посветеност и одговорност ја имаат главната улога.
Институтот за медицина на трудот на Република Северна Македонија, единствен колаборативен центар на Светска здравствена организација во нашава земја, со долгогодишно искуство во следење на здравјето на здравствените работници, се приклучува кон одбележувањето на Светскиот ден.
Преку повеќе студии и истражувања ги идентификувавме главните проблеми со кои се соочуваат здравствените работници во нашата земја, како што се уборните повреди и ризикот од инфекции, мускулоскелетните нарушувања, алергиските заболувања, насилството на работа, како и стресот поврзан со работата и синдромот на соборување.
По повод Светскиот ден на безбедност на пациентите за 2020 година ја промовираме идната акција на Министерството за здравство, а тоа е изготвување на национална програма за заштита и унапредување на здравјето на здравствените работници во нашата земја за периодот 2021-2025 година.
Институтот за медицина на труд со поддршка на Министерството за здравство и Канцеларијата на СЗО Република Северна Македонија го одбележува овој ден со клучната порака на Светската здравствена организација. Зборуваме гласно за безбедноста на здравствените работници.
Зборуваме гласно за безбедноста на здравствените работници.
Fantastic. What an amazing message from North Macedonia, where we see true examples of the outcomes of World Patient Safety Day. We've got a few minutes left, about 14 minutes left before we close this session today. So let's see if we can get some questions coming live from the audience into our panel. So Howard Catton, I think I might start with you, please, if I may. Dr. David Gold is saying, what a great presentation and great panelists. Thanks, David. David's been an emergency health care provider and experienced over 40 years ago PTSD as a result of a loss of a patient in the field. David's very concerned about the psychosocial health of impact. So I'm sorry, if we can just pause the screen, please. Thank you. David is very concerned about the psychosocial health of healthcare workers, the possibility of burnout and the impact of post-traumatic stress disorder. Across the United Nations agencies and NGOs, there's a strong need to provide guidance, strengthening psychological first aid internationally to address these issues early on. What's currently being done internationally and collectively? Howard, can you kick us off and get us thinking there?
Well, what I can tell you is that what our survey showed was that actually in many countries it is professional associations and trade unions who are providing these services. I got look at the report that I talked about. There are associations, I know trade unions are doing this as well, setting up helplines, putting counselling services in place as well. I think that there's definitely room and space for others, and I think there's a need for employers to step forward and to do more. We are seeing some who are enlightened about this because they realise that within the shortages that we face with healthcare workers, it makes absolute sense to look after, to hold on to their people. But I think there's also something, as well as the care that we owe to our healthcare workers and their families, there is something about how rich the conversations are that you then have with people who are experiencing the pressures and the psychological demands, which frequently will tell you something about how well your health systems are or aren't working. Yes, it may be, the start of the conversation may be about the health of the individual, but the information you glean, I think we see this, it tells you a lot about the quality of the service, and employers thinking about it as almost it's a quality improvement process, that getting that feedback from the staff at the front line about where things are working and where they're not, and how they can improve their services. It fits for me with I think a much wider change that we are seeing in some places, but we need to see more of in the culture of healthcare organisations. Much more participative, much more open, all of the non-blame approaches as well. I said on a webinar somewhere else, boardrooms of healthcare organisations around the world should be the ears of people in boardrooms of healthcare organisations around the world should be ringing with the voices of healthcare workers. They should be hearing on a daily basis the reality of the front line. So I think there is something hugely important about the support we provide to staff, but there is another level to it in terms of how it can help inform improvement in our health systems.
Excellent, great answer. Thanks, Howard. You actually pointed there towards employers needing to think differently too. So let's bring Julia Johnston from the IOSH Health and Social Care Group in here for a question from Andrew Baldwin. Julia, Andrew's saying we've seen psychologists being used as a stopgap to support staff on top of their day job of supporting patients. Given burnout was high before COVID and looks to be increasing, how do we ensure OSH management systems are strong enough that those brought in to support staff don't end up being burned out themselves?
That's a good question, Andrew. It's all about the resources, isn't it? To ensure that staff are, and certainly the resources are there in health and social care, and to ensure that nobody is burnt out, we need to ensure that there's systems in place for this not to happen. So there is monitoring in place for our staff and the psychologists who are supporting the staff, and having debrief sessions for staff. And just recently I heard about a Schwartz's method of debriefing, and certainly looking at sessions for staff, just I suppose overall supporting staff, whether they're psychologists or the staff reporting to psychology departments or counselling departments. But we do need the resource that's in place for staff to be able to access them.
Thank you. Let's bring Dr. Gwen Brachman from ICO here into this one too. Gwen, any further thoughts that you can add to the comments that Julia's given here about this idea that we bring support staff like psychologists and care workers in to provide extra care, and there's a risk of these people burning out too? This sounds like it could keep going on and on and on, right?
Right. It can keep going on and on. And doing a review of the literature every day, it's surprising to me that in the beginning, everybody was focused on infections and PPE and for health workers. And now the focus is on mental health, well-being, burnout, PTSD, second victim syndrome, stuff like that. And in the past week or so, I've been seeing articles written by psychiatrists and psychologists about them needing help also. So you're absolutely right. It's just rolling over and over. What I can say is, I'm retired, so I don't provide services anymore, but speaking to my colleagues in the United States and Canada, a lot of the occupational safety, a lot of the occupational health services in hospitals have set up special services for counseling. And I think one of the things that we would like to promote is that when you have things piecemeal, you have your group that does infection control, and you have your group that does industrial hygiene and so forth and so on, that things get fragmented. And one of the things that we, as occupational health professionals, want to promote is that we need to work with these groups, but under the aegis of a professional in occupational health and safety, because we understand and we know to address all these issues.
When you said that you're retired now, but that doesn't mean you get off the hook very easily. You know my style. As a doctor, what advice would you give for us as OSH practitioners here? Because as I suggested earlier, that movie really resonated with me, The Fundamentals of Caring, that we've got to look after ourselves in order to be able to look after each other. Is there a risk right now that OSH practitioners and healthcare workers will run fast towards burnout, stress and anxiety and other issues because we're not taking enough care of ourselves?
So I'm going to actually address this from the perspective of back in the day when I actually did internal medicine. And I can admit that there have been several times in my career that I have experienced severe burnout, to the point where I actually eventually went into occupational health, occupational medicine, because dealing with patients dying, and dealing in specifics with patients that die because of errors or people who aren't supposed to die. You know, there is a time in life, the life cycle goes such that you can help people when it's appropriate for them to come to the end of the life cycle. But it's very, very difficult for us to deal with people who aren't supposed to die. And particularly if we've been trying to prevent that. I don't know, I guess, I don't know the answer to this. I know that my own experience was that you carried this with you yourself and tried to deal with it. And that is very difficult because you don't recognize, you think it's just you. And it's something you've done or you haven't done enough. Yeah. And I think it's very important for doctors and nurses and all of us who give care to form groups where we can share this, not just in the time of COVID, but all the time. That, you know, doctors and nurses and clinicians were supposed to accept this and we're supposed to stiff upper lip it and just deal with it. And that's why the incidence of suicide and psychiatric stress in the healthcare professions is the highest in the world. I don't have an answer. I think it's kind of up to our professional unions and our professional organizations to start really stressing that.
Well, I feel immensely privileged to have had such an open and personal response to that question. Thank you for being brave enough to share your thoughts and experiences on what it was like for you. As a psychologist, I'm also feeling the stresses and pressures and the overwork and feel like on days, I feel like I'm getting close to being too much and getting towards burnout. And one of the things that I'm trying to do is catch myself in those moments, be more mindful of it and take myself off into my garden and talk to my vegetables as they're growing there in the garden, or to stand in the sunshine and look at the sun and allow it to feel on my skin and breathe deeply. And maybe some of these little things can be helpful, right?
Yeah, they can. And I think for all of us who are in the healthcare professions, I know I have flashbacks. I have flashbacks to residency, and they'll just come up out of nowhere when I remember a patient experience. And this is now 40 years ago for me. And I still have these things that come back to me, and I have to go over it again in my mind and say, you know, things happen, and the longer you are away from it, the more you can deal with it. But it would be so helpful if we had groups where we could meet together and share these experiences.
Yeah. And you know, in the absence of those such groups, I think a key lesson for me during the pandemic, Gwen and all of the panelists, is the importance of human connection. Whether it's through virtual meetings like this or informal meetings or WhatsApp videos or Zoom calls or having physically distant chats with people, to check in and to let people in our network know that we're here, we care for them, to find out how they're doing. So on that note, I'm afraid that we are out of time and I need to bring us all to a wrap up. So Dr. Gwen Brackman from ICO and all of our other panelists, thank you very much for being here on this really great webinar today. Thanks to you for joining us on the webinar, and for those of you who are live on YouTube too during our live stream, great to see you. Thank you for joining us. A special thank you to the World Health Organization for your address and for bringing this panel together. Many thanks, muchas gracias, merci beaucoup to the interpreters who have helped us make this webinar more accessible. Before I finish talking, quickly look in the chat box to see if there's any links that you want to click on and get any resources. Of course, we'll post the replay of this webinar and all of the slides and the resources on the IOSH website that's dedicated to coronavirus. It's iosh.com/coronavirus. Please go well, take care of yourselves and each other. Stay safe and healthy and well.
Andrew, thank you very much. Thank you very much for moderating this workshop. I want to finish with one message, and to call everyone on action, and to have national campaigns, and to run events, and to report these events also to WHO. And these are the sources for the campaign materials and how to report the events. So I urge everybody whatever you do, report it, because this provides the connection and the momentum for action. Thank you very much.
We'll include a link in the we'll include a link in the pack that we share with everybody with that slide. Thank you very much for sharing it. I wish you all very well. Thank you. Have a great day. Bye-bye for now.
Bye. Bye. Thank you.